Yeah. All right, well, why don't we get started? I'm actually going to turn it over to our lovely co-chair, Ms. Tornisha Stokes, for our official welcome.
Okay. Welcome, everyone. Happy Thursday. Thanks for joining our July Healthy Connections Workgroup meeting. Of course, we're going to be doing an icebreaker, but in the meantime, can you please type your name and organization in the chat? And please note that this meeting is being recorded. And so today's agenda, we're going to have an icebreaker. As I mentioned, I'm currently doing the welcome. Again, welcome everyone. We're going to have updates regarding the Prince George's Care Health Action Coalition. We're going to discuss reflections for last fiscal year, because currently in the county we're in FY27, but we'll be discussing reflections of FY26. And then also we'll be doing a planning polls and discussion for FY27, discuss our proposed mission, vision, and value statements. So we're really looking forward to everyone's input. And then we will have the community announcements and then adjourn the meeting. And so with the icebreaker, as I mentioned, to put your name and your organization, but another request, can you please tell us one thing you're most excited to do this summer? And I can start. Twanisha Stokes, work here at Prince George's County Health Department. And one thing that I'm excited about to do this summer that I did go out of the country to a beach. I went to Cabo, but I'm also excited about making some local beach visits as well, me and my family. So really looking forward to that. So if anyone like to share, you can also, come and speak as well, or just if you feel comfortable putting it in the chat, then that's fine also. And I see Margaret. She's visiting her children in Michigan and Nashville. Oh, how nice.
Safe travels,
Well,
Margaret.
well, I took a
Absolutely.
vacation. I took a vacation, I think 2 weeks ago. I did not feel like online. I did not feel like planning. I did not feel like packing to unpack. So I just really, really rested because I was tired. I just rested. So I'm looking forward to do something later on, I guess.
Okay. Do something fun.
Yeah, that's good. I'm having a great weeks with my little one. Just about some.
And Shanae, you was breaking up. I don't know if that's my computer or Shanae's. Did you guys hear Shanae?
Yeah, she's breaking
No,
up.
she was breaking up.
Oh no, I was saying I'm enjoying riding my bike and lots of swimming with my little one.
Oh, good.
I definitely during the summer I like to get outside and go on a walk here and there, but I definitely want to try to make it back to the beach at some point before the summer is over. So that's something I'm looking forward to.
Yes. Okay, well, thanks for sharing. You can continue to put in the chat if you like, and I'll turn it over to Shanae.
Awesome. Thank you, Tornisha. Are you all able to hear me now, or is it still breaking up? You can hear me now? Okay.
Yes.
Awesome.
Yeah.
Awesome. All right, great. Well, before we move into today's reflection and planning discussion, I'm actually going to turn it over to AJ, who's going to share just a few quick updates from the coalition. AJ?
Thank you, Shanae. So first off, we are continuing to move forward with the CHIP draft. We are finishing up the first draft now, and it was actually sent over for review to our health director. So looking forward to getting that information back. Once that first draft is complete, it will go through that review process also with the OAP team and co-chair leadership. The goal is to make sure that the final chip reflects the work priorities and voices of each work group cohesively. Excuse me. Second, we are also beginning to think through the implementation plan. As we move from planning into action, we want to make sure strategies are realistic, collaborative, and connected to the partners and resources already represented across PGHAC. Today's discussion will help essentially support that next phase, especially as we reflect on FY26 and begin planning for FY27. Third, PGHAC is also updating its membership process. We have a new membership form that will help us keep our directory current, confirm workgroup participation, and better understand how members would like to stay engaged moving forward. We will discuss this later in the meeting, but we do encourage everyone to complete the form when they have the chance. And lastly, we're also working on updating PGHAC's Articles of Collaboration, which serve as the coalition's bylaws. This is part of our effort to strengthen that structure, the roles and the overall operations of the coalition as we move into that next phase of work. Back to you, Sinead.
Awesome. Thank you all so much. So a lot of moving pieces behind the scenes, but we're working really hard and really diligently to make sure this coalition is structured well and that it's working for everyone involved. So appreciate you all and your contributions, your feedback. I know we've had a few survey links going out, and I know if any of you are like me, I am surveyed out, but it really is important that we get this feedback so that way we're structuring this coalition to be effective for all. So thank you all so much. And thank you, AJ, for those updates. As we move forward, we're going to talk a little bit about kind of reflecting a little bit on this past year. As of last week, I've officially reached my first year with the coalition and with the health department. And I think AJ's at his 6-month mark. So it's been quite a time, a fun time, definitely a learning curve. And we've just had the awesome opportunity to meet so many incredible partners like you all, to learn from all of you, and to work alongside you all and our incredible co-chairs to really grow and strengthen this coalition, and to be tasked with the big project of this community health improvement plan, and to do it in 8 months was like, wow. So kudos to you all for being patient with me and working alongside me to get this done. We are near the finish line, and this draft of the chip, it looks awesome. So we're just waiting on some feedback from our coalition leadership, and then we'll be sure to share that out with you all as soon as it's finished. But as last year comes to an end and we're starting this new fiscal year, moving into this new year, I did think it would be valuable to spend a little bit of time reflecting and then planning for the upcoming year. So I really thought today's conversation it would be really good at looking at what's working well, kind of talking about where we can improve, and also kind of helping to shape how this work group moves into how it moves and how it operates, so that as we move into this implementation phase over the next couple of years, we want this to again be effective and work well for us all. So what we're going to do is we're going to start with what I call our glows. And so these are all the things that we think we've done really well as a coalition. Maybe it's specific to this work group. And again, it could be anything that we may have accomplished together. Maybe there's a specific meeting that you really enjoyed, a partner that came and presented, a specific way that we've collaborated, or just something that you want to see us continue doing in the new year. So I'm going to open the floor. There's no wrong feedback here. We really just want to hear what stood out to you the most over this past year. And you're welcome to use the chat, or you can unmute yourselves to share. Any feedback, any thoughts?
I like our new name, the Healthy Connection. So I like the rebranding. And also, I think what was very important was finally identifying a goal. I know we had so many, but just really identifying the major goal that we've seen that we need to address first, which is, the access to care, and then coming up with strategies to get to the next level. So I think the group did a really good job with identifying that and identifying next steps.
I love that. Thank you. Thank you, Farnisha. Any other thoughts?
Yes. I like as she mentioned, Ms. Stokes mentioned about the goals to help our clients in the community, with the chip they can do their own research because I'm finding that a lot of clients are not only not reaching out, but don't know where to go, don't know where to get the help from. I had a client call this morning about that, and I shared some information with her because it's a lot of people in our community that's going through. It could be food, it could be anything, not knowing it's help out there for them. But
Mhm.
how do we get the word out to them to do their own research?
Yeah, that's good. Thank you, Miss Denise. That's something we're definitely going to be actively working towards with our chip, kind of to Tarnisha's point, coming up with these strategies, looking at what programs exist out there and that we can help to promote over the next few years. So really exciting work to come. Any other thoughts or feedback?
And
So, yeah,
oh,
sorry, go ahead.
I was just going to say, I think that the systems approach is the best way that we have looked at things, and to keep doing that in, not looking necessarily at individual programs, but looking at how we overall get the word out and make what exists work for people who are looking for assistance. And I do think it's a linked systems approach to be able to do that.
I like that. That's good. Thank you. Adam?
Yeah, you know what? Honestly, what I was going to say is was similar to what Sharon was saying. I really did enjoy our conversations just about like our advocacy meetings, just honestly being able to put our heads together and talk about ways to increase access um, amongst our clients and just folks out there. We just really are able to learn from each other and just being able to get the word out into third spaces and things of that nature. I feel like those were very, very productive conversations that we had.
I love that. Thank you. Awesome. So if you see me looking down, I'm just taking notes from everybody. So thank you for that feedback. I really, really appreciate that. Okay. So moving along, again, if you have any other thoughts, you can write them in the chat. I see your comment, Shanika, I agree, identifying the gaps. So thank you for that. So one thing that we know is that everyone here in this work group and across all work groups in this coalition, you all are volunteering your time in addition to your regular jobs and with all that you have going on at home. And we really, really do appreciate that. We also want to know what has made participating in this work group worthwhile for you all. What are you all finding most valuable about participating in this work group? And AJ can launch the poll in the chat, but if you're unable to access the poll, I have the question and the responses on the slide, and you're welcome to respond via the chat. So what has been most valuable about participating in this work group? Has it been building partnerships, learning about all the community resources, helping shape the chip? Is it community engagement, learning about all the different programs that exist? What are your thoughts? What have you all found to be most valuable? I'm seeing some feedback coming in. Looks like networking and building partnerships, learning about resources, strategic planning, community engagement. Okay. Chip development. Love it. Let's see. Give another second for a couple more responses. And again, you're welcome to share about your response aloud or utilize the chat. It looks like networking and building partnerships was most valuable. And then we kind of have a tie with community resources, chip development, and then strategic planning. Love that. Anyone care to share aloud why they made their selections?
Yeah, I'm getting to saying something went wrong. Please try again. I don't know why I selected three, but I like the network and building. I have already learned, not already, because I'm not, we are not there yet, about the community resources, but the chip development. I really, really like that.
I love that. Thank you, Denise. And Shanika's comment, being new to the county, everything was useful. I agree. Yeah, I find value in just about everything that we've done here. Sharon's comment, community engagement. Was anyone else about to speak aloud? I'm sorry if I spoke over you. Okay. Well, great. This is really helpful, especially as we are planning our meetings for this new year. It's really good to know what everybody actually finds valuable, and then we can structure those meetings kind of around those things. So thank you all for that feedback. And so now let's shift to what we'll call, we had our glows, so now we'll talk a little bit about our grows. Every organization has opportunities to improve, and we're no different. And so I'd like to gather your feedback to help make sure that these meetings, that our work group meetings, our coalition meetings, are really worth your time, and that this coalition continues to meet your needs. Again, this is the community's coalition. It's not mine. It's not the health department. It's our coalition. So I'd love to hear from you. What would improve your experience as a coalition member? What would make meetings feel more valuable, more worthwhile? Any thoughts? And again, you can use the chat or share aloud. What would make your participation more worthwhile? And if nothing, it's okay to continue. Okay.
I'm just gonna quickly fill some silence here, and I want
Sure.
to
Thanks,
get
Taylor.
reactions to this idea. So please, everyone on the call, please add to this. But I'm thinking of ways that we can continue to diversify our membership, and I'm thinking of ways that we can all champion for this work group, invite members to this work group. And I want to make sure that we're all on the same page as to talking points for the Healthy Connections work group. So I'm curious if others in the group would think that it would be helpful if you're reaching out to any colleagues or any other programs that you know in Prince George's County that you think that should be a part of the Healthy Connections work group. If you think it's worthwhile for us all to put our big brains together and figure out some talking points about the Healthy Connections purpose, what we're aiming to do, and something that gives kind of a high level overview. And then Shanae, I know you and AJ do a really great job of providing some sort of orientation to new members, but I think if we could all, kind of get on the same page as that, I think diversifying our membership, that would definitely enhance all of our membership and the ideas that we're able to come up together and begin implementing.
I love that thought. Any other feedback?
And I think, Taylor, that's a good point. And once we identify our mission and vision, that will help identify like those talking points and overview of the work group. Mm-hmm.
Absolutely. Yeah, I think the mission, vision, and value statement. So we'll send that out for feedback a little bit later. But to get that insight from you all definitely will help structure the coalition as a whole. But if we do want some talking points specifically to the work groups, happy to work with you all to prepare something like that. And then like I said, the chip's almost done, so you'll have that as well. We can pull some talking points from that as well if we want to share about what our goal is for this work group, what some of the objectives are, what we plan to do to address the issues in the county between the data and all of that. So I'm happy to work through that with you all. That's a great idea, Taylor. Thank you.
Yeah.
Okay. Well, kind of to that point, Taylor, you are always like one step ahead of my thinking. So thank you for that. But one thing that we are striving to do is not only increase our coalition membership in terms of numbers or as a whole, but to also enhance participation for those who are already attending. We know life is busy. Again, there's work, there's family responsibilities, there's traffic, which I was in for an hour today. There's competing meetings. There's a lot that we are all balancing. Like Miss Denise said, she took a break from life. And like that's the kind of vacation I need. So I might be reaching out for tips. But we really want to better understand, what are some of the barriers that you all faced this past year that made attending this work group meeting a little bit more difficult? So yeah, was it like the amount of meetings that we had? Is the meeting too long? Were there other scheduling conflicts? And thank you, AJ, for launching that poll. I forgot. And again, the question and responses are on the slide if you need to respond that way. Any thoughts? Looks like we have some scheduling conflicts, it's changing. Too many meetings, unclear expectations, meeting fatigue is a real thing, yes. Meeting length, okay. This is all great feedback. See if anything else comes in.
I'm sorry. I don't know why me and Adam's feedback is not going through.
Okay.
But
Feel
I'll
free to
fix it.
respond in the chat, or you
Chat,
can share
okay.
aloud. I'm taking notes too.
And Shanika mentioned staffing issues. That's a good
In the
point.
sense of not having enough staff to attend all the various responsibilities.
That's correct. I'm actually covering for more than one person, so yes.
Shanika, sorry. Okay. Well, we appreciate you being here. Thank you so much for being flexible with us. And I see everybody's comments, scheduling conflicts, meeting fatigue. All right. Thank you all so much. All right. So thank y'all for sharing those reflections. Now that we've looked back a little bit, let's spend a little time looking ahead. And your feedback today is actually going to directly help shape how this work group operates this year, especially as we go from planning that chip and then putting it into action. So a couple of things we'll cover fairly quickly because I know we're already almost at the 11:30 mark. We will have a little bit of discussion around work group structure and meeting cadence. We'll talk about coalition growth and partnerships, which we touched on a little bit already. We'll also briefly talk about the new way we're identifying our membership engagement structure. And then close with that mission, vision, values feedback form so you all can provide that insight. Because again, we want to reflect where we are today with this coalition. So why don't we get started? And there's a bunch of polls here with this. So again, Denise, Adam, anyone else, you are welcome to respond in the chat or you can share aloud and I'm taking notes. So I have everybody's responses documented, okay? So let's start with meeting frequency and a little bit about how this work group is structured. Healthy Connections currently meets on a monthly basis, and this was incredibly helpful, especially during that planning phase of the chip. We really broke that process down and took spent time piece by piece building this action plan. And we learned a lot about what some of our partners are doing in the community, how we all can collaborate and contribute to the efforts that are out there. And so now that we're entering this implementation phase and some planning around this implementation, we want to make sure that our meeting schedule supports the work and that it still works, again, for all of you. So what do you think? AJ, if you could launch that poll, should we continue meeting on a monthly basis? Should we move to the bi-monthly meeting structure? Should we consider something different? And you all, I think the poll has been officially launched, so you're welcome to provide your feedback there, share aloud, or utilize the chat option. Seeing so far 75% monthly, 80% monthly. Adam, I have your note for monthly. Lisa, monthly. Thank you. Awesome. Okay. Along those same lines, Denise, I have your comment too. Thank you. So that's meeting frequency. Along those same lines, let's talk a little bit about meeting length. So we currently meet for an hour. Do you all feel that that is still enough time? Do we need to extend to a longer meeting time? 90 minutes is an option. We have another work group that was meeting for 75 minutes, which is like an hour and 15 minutes. Or should we consider another option? And I believe that poll has been launched as well. You can use the chat or share aloud. Denise, I have your comment. Thank you. Adam, I have your comment. Thank you. Looks like everyone is on the same page with maintaining that 60-minute, hour-long meeting. So thank you for everyone who contributed to that. And we will have that noted. Right. And then the last thing we want to consider is our meeting format. So currently, all of the work group meetings meet virtually. We have the quarterly coalition meetings are sometimes in person, but our monthly work group meetings are virtual. Should we maintain that? Do you think that would encourage the strongest attendance and engagement? Should we consider in person, maybe a hybrid option? What are your thoughts? Again, we have a poll for that. AJ, if you could launch that. Denise, I have your comment. Thank you all for those who have voted already. I see virtual, I see hybrid. Okay. Awesome. So it looks like we're a little over 60% for virtual. Okay. Adam. Well, if you don't mind me reading aloud, while I would like the hybrid option, virtual sessions would probably encourage the highest attendance. Okay. Comment noted. Thank you. Awesome. All right. Well, this was helpful. So thank you all so much. It looks like we will be maintaining the current structure as is. But if there are any other changes that come up, we will be sure to communicate that to you all well in advance. So thank you all for that feedback. So that's a little bit about our monthly meetings. Now let's shift to our quarterly meetings. So our coalition-wide full quarterly meetings, they're designed to bring all of our partners together. We share updates from the health department, from the coalition. We're learning from one another. We're engaging with one another, networking, and really just trying to stay aligned around some of these shared priorities, especially now as it is related to the CHIP. So as we continue to strengthen this participation, reduce barriers to engagement, we want to explore whether the current coalition meeting structure best supports our diverse membership. So currently for our quarterly meetings, we meet in the evenings quarterly on a Tuesday night from 6 to 7:30. And I will say attendance has grown in just the year that I've been here, and that's fantastic. I'm so grateful. But we also know that there's still room to make these meetings even more accessible and to grow our participation. So again, we want your feedback. Would holding our quarterly coalition-wide meetings during regular business hours make it easier for you to participate? And I believe AJ has launched that poll. And if so, what time of day? We can look at morning options, midday lunch options, late afternoon, or we can maintain that evening structure. We really just want everyone's feedback. And with the coalition-wide questions, we're looking across all 4 work groups. So we'll take your insight and we'll compile it with the other work groups and make a decision then. So I'm seeing some feedback for mornings. Denise, I see your comment. Adam, I see your comment. Lisa, I see yours. In the poll, we have evening, morning. We have an afternoon option. Okay, great. This is fantastic. Thank y'all so much. I'm just seeing if anything else. Did I miss anyone? Nope. Okay. All right. So again, we'll take this feedback and compile it with the other work groups and make that decision. So thank you all so much for that feedback. And then just as we talked about with the monthly meetings, we also want to know what factors influence your ability to participate in these in the quarterly meetings. So again, we want to keep things in mind. Like we know for the evenings, traffic has been an issue, the commute time, work schedules, caregiving responsibilities. In the fall, my kid has sports, so sometimes it can be a little tricky coordinating evening work events. Is it transportation, competing meetings, other commitments? What are the two biggest factors that influence your ability to participate in those quarterly meetings? We can launch that poll as well. Adam, I see your comment. Thank you. Looking at the poll, it looks like we have time of day, transportation, family, personal responsibilities. Okay. Meeting content value, work obligations. Awesome. Awesome. Thank you. Denise, I see your comment. Thank you for your response. This is great. Thank you. Awesome. All right. So again, taking this feedback across all 4 work groups, Lisa, I see your comment, and we will make a decision. We do have a quarterly work group, quarterly meeting coming up in September, which I feel like we just had our last one, so that's quite a quick turnaround. But we will make sure that we communicate any changes to meeting time, meeting structure with you all well in advance so we can plan accordingly, okay? And we will provide food. So more to come. Okay. So thank you all for the feedback. All right. So Taylor alluded to this a little bit. One thing that's really important to us is making sure that there's room at the table for everyone. We have a pretty diverse coalition to date, but as we continue growing our numbers, we also want to enhance the quality of this coalition as well. We want to make sure that we're hearing from sectors and communities that may not yet be represented or maybe just aren't represented as well. And we want to maintain that representation because we're really looking for opportunities to go out in the community, to serve our community, whether that's with various programs, initiatives, projects. So I want to open the floor and have a little bit of conversation. Who do we think is missing from the coalition? What sectors are currently underrepresented or should be a little more engaged with PGHAC? And you can use the chat or you can unmute yourselves to share. Any thoughts?
I had 2 thoughts. One is non-health organizations that they either have a broader agenda, but where we would want to have health be incorporated into somebody's agenda. Like if they're informed that they will know, and whether it's a civic organization or an advocacy organization or a food bank or direct service provider, something that goes beyond health. I think there could be greater effort towards reaching those types of groups.
Awesome, love that. Any other thoughts?
And I was thinking maybe like the school system as well. I know they have the clinics there. Like the nurses maybe from the school systems, or even like maybe the cafeteria workers, teachers, just someone from a representation from the school system.
Okay. Love that. Thank you, Tarnisha.
Mhm.
Any other thoughts? Emily, thank you. I'm here from the
Sorry,
Office of
Emily.
Mental
Thank
Health.
you.
Love
That's
it.
okay. That's okay. I know we're not always able to make it, but I like your idea of involving the nurses too. And we do have additional school-based health centers in I think 5 of our schools. So I'll pass this information along to our nurse director of school nursing.
Thank you, Emily.
Good. Thank you. And I see your comment as well, Denise. More nonprofits in the county. Shanika, do we have reps from the county, like in terms of county council, government? Yes, we do. A lot of times there's meeting conflicts. And so while they're on the listserv, they get the information. Every once in a while, they'll pop into a meeting here and there. But I am definitely hoping to re-engage them a bit more. So if you all have any contacts or people that we should be reaching out to, please let us know. We're setting up a bunch of partner meet and greets this month to grow the coalition, to learn more about the partners that are out there, what people are doing. So yes, send your contacts, send your recommendations. Sharon, I see, agree, school system is really important, not just nurses, but also counselors. Yes, I agree. Awesome. I think I saw a hand. Is that you,
That's
Emily?
Yes,
me. Yeah, that's me
Emily.
again. I was just wondering, I can of course spread this around in the school system too, but I was just wondering if you had like a one pager or any like kind of brief description that I could share for some additional context rather than me just like sharing the meeting invitation might be helpful.
Yeah, sure. So we have been working on that. And so I can get that to Emily. If you want to, I'll actually put the email in the chat. If you want to send an email, and I'm happy to follow up with you to have that conversation to share with you. And if you want to loop me in to
Perfect.
reach out or anything, I'm happy to do that.
Great. Thank you.
Love that. Thank you. Taylor, we should try to engage staff members of the council members. I know they get several calls from constituents for resource referrals. Also, we need to re-engage DSS. Jay is no longer, oh, okay. All right, noted. Thank you. Love this. Thank y'all so much. Please keep the recommendations coming. Again, you can email PGHAC or you can email me directly with recommendations or contacts, and we're happy to set up calls. So thank you so much. I have a contact for a service that provides. Perfect. Send that. Go ahead and email PGHAC and we'll get connected, Miss Rhonda. Thank you. I love that. Wonderful. All right. All right, so moving on, because I'm looking at time. As our coalition continues to grow, we also want to make sure that it is easier for people to participate in ways that really best fit their expertise, their availability, their capacity. Again, I recognize we are all being pulled in a lot of different directions. And so that's why we've officially and recently launched our new PGHAC membership form. And within that form, for those who have already completed that, thank you. But you will notice that there are 3 different levels of engagement that are really just intended to provide flexible ways for the organizations, for residents, for our partners to participate in ways that feel most meaningful to them, while also trying to remain accountable to our CHIP, to our goals, objectives, and have that implementation support as well. So some members may simply want to stay informed, which would be our level 1. You get our newsletter, you'll get updates about our quarterly meeting, you'll be informed about the CHIP. You may want to stay connected and participate as a work group member, as you all are doing. And then we have some who want to do a little bit of everything, which is, hey, keep me connected. I want to engage with the work groups as well as help assist or lead with pushing this CHIP forward with all the implementation efforts. We welcome it all. So we will make sure that you have access to this hyperlink as well. I think we have a QR code in the community announcement section as well that you all can scan to complete that form. So more to come on that, but this is our new way to make sure that we have everyone's updated contact information as well as how you all want to engage with the coalition. We know a lot of emails go out. We don't want to be overwhelming. We want to make sure the right information gets to the people who want that information. So we'll definitely talk a little bit more about it in the community announcements. And then last but not least is our mission, vision, and value statement. We know that this is truly foundational, not just for our work groups, but for our coalition as a whole. And over the past year, this coalition has really just continued to grow. There is great momentum here. Our partners have expressed the excitement around the work that we're doing. And so we've been really trying to refine the direction of the coalition. And as we've developed our chip, we've also taken a lot of time behind the scenes to reflect on who we are as a coalition and where we want to go together. So our mission, our vision, our values, they're more than just, a few words on a slide or on a pamphlet. They really do help to guide our decisions, to help shape our priorities. And really serve, as the foundation for how we work together to improve the health and wellness of all residents and visitors of Prince George's County. So as a part of this strategic planning process, the coalition leadership team, we've drafted some new mission, vision, and value statements that we felt reflect the coalition's evolving purpose as well as its future direction. But again, this is not our coalition. It's all of ours. So we really want to hear from you before we finalize them. So your feedback is super important. So feel free to scan the QR code. Again, the links are all hyperlinked in the slide, which we will send out post-meeting. But your feedback is really important because these statements are going to reflect the collective voices of the coalition, not just us. So again, we invite you to scan the QR code, click the link, and provide that feedback. We're looking at a deadline of August 1st. So I thank you all in advance for doing that, to helping us further shape the direction of this coalition. So thank you all so much. And before we move to our community announcements and before we wrap up, I'd like to leave you with one final question. We talked a little bit about where we've been, what worked well, what we want to improve, where we're going, and how we want to format our meetings so that way we can still effectively work together moving forward. So if there was one thing, I had two fingers up, but one thing that the PGHAC should prioritize this year, again, because we want to remain impactful, we want to be action-oriented, we want to be inclusive, keeping equity in mind. What is the one thing that the PGHAC should do or prioritize this year? Again, you're welcome to utilize the chat or to unmute yourselves. And I see your comments as well, so thank you, Taylor. AJ, if you can put the feedback link in the chat. Thank you. What's one thing the PGHAC should prioritize this year? Any thoughts? Okay. Well, one thing we will be doing is definitely that chip implementation, being very intentional about collaborating across partners, making sure we're working together and not in siloed efforts. We're going to have opportunities to not just work with the various partners in this work group, but to also work across work groups. So I'm really excited about that. Shanique, I see your comment, decreasing the uninsured rate. Denise, getting the chip implemented in the county. Thank you all for that feedback. And those have been echoed across work groups. So thank you for that. It seems like many of us are all on the same page. I think there's some changes to Medicaid coming up that might be highly affected to this county. So there's going to be some conversation around that and what we can do to help with those efforts as well. So a lot more to come. Awesome. All right. Well, with that, I'm going to now turn it over to AJ to share a few community announcements with you all. AJ?
First announcement is an exhibitor opportunity from the Southern Maryland chapter of the National Black Nurses Association. They are currently looking for exhibitors, so this may be a great opportunity for organizations that would like to share resources, promote their programs and services, or connect directly with community members. Organizations that are interested should complete the required online registration form by 6 p.m. on August 15th. There is a $25 exhibitor registration fee, and for questions or additional information, you can use the contact information listed on the slide. Our next announcement is the MEI Faith Fest 2026, a free event that is open to the entire community. Come and enjoy a day of connection, resources, and community care for the whole family. The event will take place on Saturday, August 15th, 2026 in Greenbelt, Maryland. Vendor registration is also available, so organizations can have the opportunity to participate, share resources, and connect with residents during the event. For more information, you can call the number on the slide or email the email on the slide. Please share this opportunity with your networks and any organizations that may be interested in attending. Our next announcement is the 2026 Multiple Melanoma Research Foundation Washington, D.C. Walk. This walk will take place on Saturday, September 26th at the National Harbor. The official walk start time is still to be determined. Anyone interested in participating can complete the registration form online. Additional information and a contact form are also available through the event website listed on the slide. So this will be a great opportunity to come together, raise awareness, support individuals and families affected by multiple melanoma, and contribute to continued research. Next up, we have the Greater Washington Region Health Walk that will take place on Saturday, November 7th, 2026. The event area will open at 8:30 a.m. and participants can register online using the information provided on the slide. For general event questions, you can email the first email on the slide, and for sponsorship inquiries, you can email the second email on the slide. Please consider participating or sharing this event with your staff, partners, families, and community networks. Next up, we have the University of Maryland interview outreach request. The University of Maryland is also requesting support with participant recruitment for a public health study. So the research team is looking to interview participants as part of a study designed to help develop a teaching tool for public health students. So this could be a really cool opportunity for community members to share their experiences, contribute to the education and preparation of future public health professionals. So for any questions or additional information, please contact Jenna Yang, and her information is listed on the slide. Our final announcement is a free Medicaid education and resource navigation opportunity offered by Coaching Salud Holistica in partnership with Maryland Physicians Care. They are helping individuals and families throughout Maryland better understand Medicaid and access available resources. Their team can help residents learn whether they may qualify for Medicaid, understand the application or renewal process, learn more about Maryland Physicians Care benefits, and also connect with trusted enrollment partners for additional assistance. Anyone interested can complete the form shown on the slide to get connected. For questions or direct assistance, residents can call Coaching Salud Holistica. Their information is listed on the slide, and they also do offer translation services. So please share this resource with residents, clients, or families who may need help understanding their coverage or navigating the Medicaid process. And with that, back over to you.
So thank you, AJ. So again, we talked a little bit about that new PGHAC membership form. We will put the link in the chat, AJ, if you don't mind doing so. And yes, we will be sharing the slides and announcements out as soon as possible. We have to just wait for the link for the recording. Once we get that, we'll send it out right away. But again, please complete this membership form. It'll help us keep our records up to date. Again, make sure that we're communicating and sending out emails to all the right people, identifying the work groups you want to be a part of, and then that level of engagement that you all desire for the coalition. So thank you all again. Again, just take a few minutes to complete that, and this will really, really help us stay organized. So, and making sure we're keeping everyone connected in all the right ways. With that, are there any other partner announcements at this time?
Yes, Adam, you can speak.
Yes, I would just like to take this opportunity. I don't know, would I be able to share my screen? No problem if not.
Yeah, sure, go for it.
Yes, so here at Community Engagement, we are actually gearing up to host a census guided training. Here, let me just go ahead and I can share this flyer with you, Shanae.
Yes, please.
Screen okay?
Yes.
Yes.
Can you enlarge it a little bit, please?
Sure. I know it's a little tight. I was just trying to get the full thing. Okay. Yeah, so essentially I just want to quickly frame this census training and why it matters for our work. You know, a lot of times when we're talking about need in the community, we talk about what we can see directly. So that's unemployment, food insecurity, housing stress, language barriers, lack of transportation, or people just struggling to access services overall. But we've partnered up with data dissemination specialist Stacy Cochran-McNeil from the United States Census. And essentially, this is going to help us connect to what we see in the field with reliable public data from the United States Census Bureau. So this is not really just a training on how to use their website, but this is about how we can make better decisions using that data. So really, this is going to be not just the introduction to the tools that the census already has, but also better understanding the communities that we serve. Now, you know, I know that we probably already analyze data on a county level, but those numbers don't always tell the full story. You see, a county can look stable on paper, but when you start looking at the zip code areas, census tracts, block groups that are for specific neighborhoods, language access, income, poverty, health insurance, internet access, and transportation, you can start seeing where all of the real gaps are in our society here. So that's really the why we decided to create this Care for Maryland dispatch. So really our goal is to identify where barriers are concentrated, analyze what those barriers actually mean, and then dispatch the right outreach, staff, referrals, training, and partner resources into those communities. So this is really a quarterly training that we're starting here on August 13th. We have a clickable link here where you guys can actually sign up. So I can send this to Shanae, and we'd really love to see you guys there. We're really trying our best to get the word out there, and we've already invited a good amount of our partner organizations. So I just kind of wanted to put it out there for you guys as well. So thank you.
Love it. Thank you for sharing so much, Adam. And yes, go ahead and send that to, you can send it to me or you can send it to the PGHAC email, and we'll make sure that gets shared out with the follow-up email that we send out. So that's awesome. Thank you so much.
Thank you.
Wonderful. Okay. And with that, I do want to note there is no August work group meeting, so please enjoy your summer. We will reconvene Thursday, September 24th. And I think we voted to maintain everything to be the same with our meeting structure as far as keeping the hour and everything. But we will make sure that that is communicated to you all before that meeting time comes. And thank you as always for your insight and your partnership. We truly value each and every single one of you, the work that you do, and just your partnership. We cannot be this far, get this far without you. It really does take a village. So thank you all so much, and we will be in touch soon. Have a wonderful rest of your day, and we look forward to seeing you at our upcoming meetings. Thank you all. Have a great
do the
day.
same.
Thanks,
Thank you for seeing
everyone.
y'all guys.